Good morning. My name is Dave Grovedal. I am the EMS division head for Onslow County EMS. More than 2 years ago, a group of dreamers and doers came together and decided that more was needed in our community to improve survivability from trauma. Those dreamers, a partnership of military and civilian leaders, wisely decided that Onslow County's trauma system was more than just a military or a civilian problem. It required a commitment from both sides of the fence. Today, we are taking a giant leap forward with the addition of low titer whole blood in our ground 911 ambulance system. Until now, trauma care has been limited to controlling bleeding and rapid transport to the hospital. If a patient has significant blood loss, there was very little that really EMS could do to improve the patient condition beyond that rapid transport to the hospital. Today, that changes. The trauma system in Onslow County has seen several significant improvements over the last couple of years. The first step was the certification of our partner, Naval Medical Center Camp Lejeune, as a local trauma center. The knowledge gleaned from the battlefield has been freely shared with our healthcare providers, and we are better for it. That was followed with equipping our EMS system with items such as tourniquets and hemostatic gauze and bleeding control techniques. Next was the training of our community in those bleeding control techniques through a Stop the Bleed campaign, a national program that teaches bystanders how to do bleeding control. We have equipped all county buildings, county vehicles, and our county schools with those kits. Today, over 6,000 people have been trained in Onslow County on bleeding control techniques, more than some states have completed. Today, we are adding whole blood to our emergency response vehicles within Onslow County EMS system. We have again moved the needle a monumental distance. Onslow County EMS is a proactive and forward-thinking 911 ground EMS system. We're proud to lead the way as one of the first EMS systems in North Carolina that will be carrying blood. We're the only North Carolina EMS system that will be carrying whole blood, and one of very few EMS systems in the United States to engage in this program. This project is a game changer for trauma in Eastern North Carolina and represents a paradigm shift in how we treat patients moving forward. Finally, as represented by all individuals and organizations here today, our EMS system is not one person or one agency. We are a successful partnership that works hard to provide the highest quality of patient care to our whole community. We are one team with one mission, providing exceptional care to our community. Thank you. I'd like to introduce Mike Patterson with the Blood Connection.
Thank you, David. Good morning, and thank you to all of you for coming out to help us celebrate the start of something truly incredible. I'm Mike Patterson from the Blood Connection, and I wanted to say a few words about what this partnership means to not only Onslow County, but the whole eastern portion of the state. This is a historic day, as Onslow County EMS will be one of the first EMS units in not only the state, but the entire nation to incorporate whole blood units into trauma response. The Blood Connection is honored to be a small part of this project, and we're looking forward to saving even more lives in Eastern North Carolina. We have seen very successful results out of similar programs in Texas and have no doubt that this will increase the amount of lives saved before getting the patient to the hospital. Research has shown that programs like this improve mortality rates significantly. In some cases, improving survival rates up to 70%. This new program is going to be a difference between life and death in Eastern North Carolina and impact families far beyond Onslow County. Every 2 seconds, someone requires a life-saving blood transfusion. It's a fact I'm sure several of you know all too well. Here in Eastern North Carolina, from the Triangle to the coast, the Blood Connection serves over 30 hospitals, including Onslow Memorial. This is another opportunity for the Blood Connection to help extend our roots here in Eastern North Carolina. And we're very excited to be partnering with Onslow EMS. If you're interested, we have one of our mobiles here today. And after the press conference, we're actually going to be taking donations. And we'd love to have you join us as a donor and help us in our life-saving mission. If you'd like more information on possibly hosting a blood drive with us, see myself or one of our representatives that are here today, and we'd love to talk to you about that. We will eagerly monitor this program and its success, and we look forward to sharing the results once things are up and running. Again, thank you to Onslow County EMS for choosing the Blood Connection as your partner for this project. We look forward to saving many lives together.
Now I'd like to introduce one of our EMS system medical directors, Commander Joseph Katora.
Good morning, ladies and gentlemen. I think it's already been stated multiple times how this project is going to offer dividends to the community, not just our military folks, but the entire community, the visitors of Onslow County and the permanent residents. It's exciting because having worked in this field for several years, I can tell you the benefits of whole blood and how magical the resuscitation can be. I think David has done a great job in designing this program and offering a technique and a protocol that is going to be very easy to follow, very applicable, and I am confident that the state is going to be very interested in what we're doing here, and this is going to transcend EMS throughout the nation. Thank you.
Thank you for coming out today. We're very excited about this program. At this point, we will now open it up for individual interviews and questions. Again, thank you for coming out today.